face off Democratic strategist Julian Epstein, former chief Democratic counsel to the House Judiciary Committee, and Republican strategist Danny Vargas. Hello, guys. Good to have you both on board.
Good afternoon.
So, Danny, I'll go to you first. 96% of Americans will be covered with the House legislation here. So it's a good thing, right?
I don't think it's a good thing. I think what it'll do is it'll add a significant amount of deficit to our economy already. It'll increase taxes. It'll reduce benefits. And I think at the end of the day, it's going to kill jobs. I think what we have to do is come back to the table and start talking about those bipartisan solutions that we can both come to the table with. Things like being able to have companies, small businesses join together to negotiate better rates. Things like tort reform. Things like being able to compete across state lines. Competition works. We've seen it in the auto insurance industry and telecommunications. There are some things that we can join together to actually lower costs, increase availability, increase access without having a government take over the system.
Okay, what about the public option, Danny? I mean, where does it fall short in your mind?
Well, what they're calling a public option is nothing other than increasing costs to the states that are already burdened with Medicaid. It's going to create a situation where the states are going to be bankrupt because of the increased Medicaid rolls. It's going to kill jobs because small businesses are going to be taxed on incredible levels. It's going to be cheaper for them to actually pay the penalties than to actually cover this.
So, Danny, then do you support Senator Harry Reid's Senate plan that will allow states to opt out?
That's another case of smoke and mirrors. It's all going to lead to a situation where this public option that Nancy Pelosi has rolled out today is going to be rolled out in both the House and the Senate. The best that we can hope for is that the moderate Democrats that understand that this is not good for America, it's not good for the economy, we can do it in a better way, that we can reduce costs without having to have the government step in, as it always has.
So Julian, with regard to the public option, only 12 million people will actually be able to take advantage of this. That's really not the public.
Well, first of all, with all due respect to Danny, those are exactly the talking points of the health insurance industry. Secondly, there are different versions of the public option between the Senate and the House, and I think initially that's true. It will be limited to a relatively low-income portion of the American public. But if the health system continues to fail, the health insurance system continues to fail, remember premiums are projected to go up to double in the next decade. As many as 40 to 50% of Americans absent this plan could be without health insurance, according to the administration's latest estimate, a study that was done by the Council of Economic Advisors. What you have with this bill is you've got near universal coverage. 96% of Americans will be covered. Pre-existing conditions will be a thing of the past. Contrary to what Danny said, the CBO, which Republicans have continually cited, has said this will reduce the deficit by $30 billion. We're doing another thing Republicans have always asked for, which is we're cutting waste out of the Medicare program by going after things like bundled payments and the Medicare Advantage program. And we are doing just a remarkable amount to bring competition into the system. The public option is one way of getting competition into the system because the health insurance industry is basically not a competitive industry today. And the health insurance exchanges are going to be a remarkable tool for consumers to be able to shop in a bazaar to find out what is the best system, the best plan, whether it's public or private, for their family. So you're going to get, you're going to get universal coverage. You're going to cut the deficit. You're going to get the waste out of the system, and all the Republicans can do is offer the same old tired talking points from the health insurance industry and say no, 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 no.
Well, before we go on to the second topic, Dan, I want to give you a chance to respond just to one of them. The CBO does say that the health care bill the House is putting forward would actually reduce the deficit by $30 billion. Yes or no? Is the CBO right?
The CBO says it reduces it by $30 billion over 10 years. What you fail to realize is that in the second 5 years, it actually adds to the deficit. So we've got to be honest about this. In the long-term projections, it's going to add to the deficit, not shrink the deficit.
All right, we'll debate that another time. But I do want to get to the second topic, and I think this is one where we both agree. Danny, let me get your reaction first. President Obama, he went to Dover Air Force Base last night. He was there for several hours. He sat there solemnly, stood there, saluted the caskets coming back as they were brought back from Afghanistan. Your reaction to the president's visit last night?
Well, I'll tell you, I'm a veteran myself, and I thought it was powerful to see the President of the United States, the Commander-in-Chief, standing there with our men and women in uniform and paying his respects to our fallen. This is one of those moments where I think Republicans and Democrats can come together to support the President's efforts to pay his respects to our young men and women in the military that are sacrificing greatly to be able to protect our liberties.
And Julian, you'd agree this is one of these issues that goes well beyond beyond politics?
Oh, I think it was a magnificent statement. I think it was the right thing for the president to do. I think he was making the point very clearly to military families that he understands what's at stake when he sends men and women into harm's way abroad. I think this is something that both Republicans and Democrats would really applaud the president for doing, just part of an ongoing process of leadership on the president's part.
All right, Julian Epstein and Danny Vargas. Thanks, guys.
Thank you.